hosted by seasoned addiction interventionist Matt Brown. This is a podcast for families or individuals with loved ones who are struggling with addiction or alcoholism. Perhaps they are reluctant to get the help that they need. We are here to educate and entertain you while removing the fear from the conversation. Stick with us and we will get you through it. Welcome, the original party wrecker, Matt Brown.
Well, thank you for tuning in for another episode of the Party Wreckers. Yes, my name is Matt Brown and I am your host. I want to start out today just by making sure, a lot of times I'll save this for the end of the show, but if you're not already joining us every Monday and every Thursday, there's a free families in crisis support call that we do on Zoom. Myself and a number of interventionists from around the country. We get on there. We have been having anywhere from 60 to 80 families every night that we do this, where we talk to them just about how to address the issues that they're going through. We give them real-time strategies, advice, and if you're not already joining us on that, it's free. Please tune in 8 p.m. Eastern every Monday, every Thursday. I want to address excuse me, I want to address a few questions that I have been emailed over the last month or so. And again, if you have questions that you want done, I'm going to do future episodes like this where I just do a Q&A. But I'm going to take 5 questions that I've been asked by family members over the last month and respond to them here. If you have a question that you want me to answer on a future episode, please email me at matt@partywreckers.com. The first question that I got is there a rock bottom? And at first I thought, well, the answer to this is obvious. Of course there's a rock bottom. But as I look back at my own life, you would have thought that I hit my bottom much, much sooner than it actually came. I think for some people, the bottom is pretty shallow. We don't have to experience a lot of pain, a lot of distress. We don't have to put our families through a lot. We begin to experience some discomfort, or the family responds quicker than others do in a situation where they want to bring it to somebody's attention and say, hey, we think you need to get some help. And the bottom can be rather shallow. Boundaries get implemented, structures get put in place, new conversations begin to happen. For others, the bottom is much, much deeper. We have to experience a lot of discomfort. We have to experience a lot of pain. And unfortunately, we put our families through a lot of discomfort and pain along the way. The bottom is really wherever we want to stop digging, is kind of the long and short answer of that. For some, unfortunately, the bottom is death. For some, the bottom is prison or jail. For some, the bottom is a mental hospital, or the loss of a marriage, the loss of an employment. There's so many different ways to define a bottom, but yes, there is a rock bottom, and it's different for every person. I think the sooner the family can get organized, the family can get educated, it limits the amount of enabling that contributes to somebody hitting a deeper bottom. And it allows that conversation to happen in a much different way than sometimes it does as a person proceeds towards their bottom, because there are entry points into that conversation along the way. And someone doesn't have to hit bottom. That's a myth that I want to dispel while I'm thinking about it here. The idea that someone has to hit rock bottom before they're willing to get help is nonsense. Please don't buy into that. Rock bottom is really when like I said, it's when we decide to stop digging. It's when the family hits bottom, decides to stop enabling, and all of a sudden the person who's in active addiction has to become responsible for themselves. There's no one left to enable them. The bottom comes a lot quicker, and it comes out in a lot less painful way if the family gets organized and educated first. Um, Second question, as a mother, how do I find the courage to set boundaries? This is a question that I think is at the core of anyone getting ready to have that conversation with their addicted loved one. Boundaries are essential. In fact, the lack of boundaries is really the biggest contributor to enabling. And as I've said before, enabling is like the oxygen to the fire of addiction. It's what allows that fire to burn. And as we limit enabling by setting boundaries, and it doesn't have to be done out of anger. In fact, it shouldn't be done out of anger. Anytime somebody sets a boundary strictly out of anger, if anger is the only thing holding that boundary in place, as soon as the anger is gone, so is the boundary. I mean, as parents, we've all experienced that where our kids have done something, we see an immediate need for corrective action. We give a consequence, we ground them, whatever the case is, take away their phone. And as soon as they start to toe the line, we may have said, hey, you're going to lose this for a week or you're going to be grounded for a week. Well, 2 days into this, 3 days into this, all of a sudden it starts to either be inconvenient for us or there's, some real dramatic change in behavior to where we start to think, oh, maybe I overreacted a little bit there. And we relent on boundaries. And so if that anger goes away, if that's what's holding a boundary in place, it's not going to sustain itself. And so a good boundary, a healthy boundary is going to stand the test of anger. It's going to stand the test of love. It's there because it's the right boundary to have. And it should be there because of love. So finding the courage to set boundaries, as this mother asked, i- usually it's the courage not necessarily to set the boundary, it's the courage to withstand the onslaught of guilt that we feel ourselves, the pressure that we're going to be getting from our child or spouse or whoever the person is that we're setting the boundary with, and really being comfortable enough in the discomfort to be able to say, okay, I get why this is happening. I understand the purpose of this, and I'm going to hold this boundary anyway. It is courageous. There's nothing weak about it. It requires an incredible amount of courage because it's a boundary is being implemented because something is not healthy, something is not working, and there needs to be some external forces brought to play to create health, to create wellness in a relationship or in a dynamic. And there's going to be some resistance to that most of the time by the unhealthy individuals that we're trying to set boundaries with. And when I say unhealthy, I'm not implying good versus bad. We all have unhealthy coping strategies. We all have things that we want to have to not change. And so when we set a boundary, the courage is really, okay, how do I have this conversation and set this in a loving way? And two, how do I keep this boundary in place once the guilt hits or once the pressure hits? And that's where you're going to need support from other people. This isn't something that should necessarily be done alone, especially when you're dealing with an addicted individual. Get some support, get some people around you to hold you accountable, and allow yourself the opportunity to feel what you're going to feel. Don't say, oh, I shouldn't feel guilty for this. No, of course we're going to feel guilty. That's part of the change that we go through when we set boundaries. There's an evolution that starts to happen. There's a change that starts to happen in us as we become less codependent, as we become healthier. It's like coming into sobriety for somebody who's in active addiction. It's going to feel strange. And as we get support, just like we're asking somebody in early recovery to get support, get a sponsor, go to meetings, go to treatment. We need that on the other side as well so that we can have the accountability and the support that we need to be able to hold boundaries. Anyways, I hope that helped answer your question. Number three, What do you do when your loved one believes they can get sober without treatment? I did have another question that was kind of related to this, and that is, when somebody is resistant to going to meetings and they say, "Oh, well, AA only works 3% of the time," which was the stat that this person had emailed me about, that her son had said, "Well, I'm not going to AA. It doesn't work. It only works about 3% of the time." The kind of the same thing is, I'm not going to go to treatment because number one, treatment doesn't work. That's a common objection that I hear, is that, I've been to treatment before, it didn't work. I've had friends that go to treatment, that have gone to treatment. It didn't work. They're using again. And so I'm going to do this on my own. Or the argument simply is, this isn't bad enough that I need to go to treatment. I can do this on my own. The problem's not as bad as you think it is. So this is something that's still within my ability to control. The old adage, I can quit whenever I want to. Um, a lot of us buy into that. A lot of us believe that. And what that really boils down to, in my experience, is I'm not willing to give up control. I'm not willing to admit that this is something that I no longer can control. I would love to change. I'd love to have an easier life. I'd love to have a better life. I'd love to be happy. But I want to do it my way. I want to do it on my terms. I want to do it in my timeline. I want to do it within my comfort zone. And that's rarely a recipe for success. And most of the time, what I'm recommending isn't go to battle with your loved one and show them the evidence and say, hey, this is why going to treatment is necessary and why this is never going to work on your own, because you've tried it here, you tried it again here, you tried it again this time, and it didn't work. When you hit someone with just a bunch of facts or a bunch of statistics, and hey, here's the abundance of evidence to show you that your way hasn't been working. Why would we want to have you try this again on your own? Most of the time, that's not going to be something that a person's going to respond to positively. To be able to say, you know what, you're right. Now that you bring it to my attention, I have not done a really good job of getting sober on my own in the past. Most of the time the response is, well, I really didn't try. Or I had this thing come up. I got fired from my job. And of course I had a relapse or return to use, or, my girlfriend broke up with me. And so of course, the needed to drown my sorrows there. And, we come up with all of these reasons as to why it didn't work previous times. But this time it's really going to work, because this time I'm really serious about being able to do it. And we look at it as if the drinking or the drug use is actually the problem. And that's not the problem. That's how we're trying to solve the problem. The problem exists on a much deeper level. And so when we think that we can do this on our own, we're looking at this through the lens of, I can change this behavior. But we're looking at it through the wrong lens. Like I said, we have to really see this for what it is. And this is why it's so important that families get educated on what addiction is and what it's not. Addiction has very little to do with whatever substance they're using. I'll get questions sometimes like, well, do they treat meth addiction? Do they treat fentanyl addiction? Do they treat alcoholism? As if they're different ways to recover based on the substance or the behavior that's being exhibited. In my experience, addiction is addiction is addiction. And there's no way that somebody recovers differently from fentanyl versus methamphetamines versus alcohol versus gambling versus sex versus work versus exercise. It's all the same animal. And when you look at just the behavior on the surface level, you're not digging deep enough. It's so important to realize, like, there's much more going on. You're only seeing the top 25% of the iceberg here, and the others 75% is below the surface, and it remains invisible until we get under the surface and really start to explore, okay, what's really going on here? Oftentimes there's issues around untreated mental health conditions like depression or anxiety or bipolar disorder, or other personalities disorders or thought disorders. Sometimes there's issues around abuse or neglect or trauma or abandonment or grief that have not been dealt with. And those things can be not just catalysts for addiction, but certainly this idea that time heals all wounds, it's just simply not true. Does the pain diminish over time? Most of the time it does, or we find a way to diminish the pain so that it's not as front and center all the time as we go through life. But there's hurt and there's damage that sometimes gets done that until we heal from that, we are going to continue to emotionally bleed for years, for decades. And until we actually find a way to heal that, not only will we not heal in our own lives, but we're also likely to pass some of that pain on to the next generation. This is what they're talking about when they say generational trauma. It's the unhealed wounds of previous generations that find their way into that next generation. And when we get into treatment and we really start to look at the causes and conditions as to why do I make the decisions that I make? Why do I have relationships the way that I have? Why do I have this voice in my head that's constantly criticizing me, or why do I have this particular behavior that continues to pop up over and over again? I continue to self-sabotage and I don't understand why. Even if we recognize that those things are there, until we understand, okay, this is where that's coming from and this is how I heal from that so that I'm less likely to continue this behavior going forward, that's when we really start to look at wellness and recovery, not just as abstinence from substances or alcohol or whatever the compulsive behavior is, but it's healing from the original hurt and wound that caused that in the first place. So when somebody says, "Hey, I can do this on my own," are there people out there that can stop drinking or stop using drugs on their own? Absolutely. Are they few and far between? That's also true. But if you look closely, many, many times what you'll see is that a person will stop using drugs or stop drinking only to find that they're now self medicating with exercise or food or work. One of the things that happened when I was newly sober is I gained an incredible amount of weight. When I got sober, I don't know exactly what I was, but I was definitely under 200 pounds. And for me, that's super skinny. I mean, you could see every rib in my rib cage. I was undernourished. I was using a lot of stimulants, which diminished my appetite anyway. And, I was underweight. Well, what happened is not only did my appetite return, but now as I began this journey, I didn't have that self-medicating behavior of using drugs or alcohol. All of a sudden I had an appetite again. I started eating everything that I could and I gained a tremendous amount of weight and I started eating away my feelings. And so I went from under 200 pounds to right around and maybe even over 300 pounds within about a year, year and a half. So food became the way that I self-medicated. And until I really started to get willing to see, okay, this is what's really going on with me, did I start to heal from some of that. Now, once I realized that my weight was becoming a problem, when my doctor said, "Hey, if you don't quit smoking cigarettes and if you don't lose some weight, you're probably not going to live until you're 40 years old." Well, then my next addiction became exercise. And within the next year, I went from almost 300 pounds back down to close to 200 pounds. And so I found different ways to self medicate as I got into early recovery. So, this idea that we can do it on our own most of the time isn't true. Um, are there miracles that happen? Are things that happen when people just suddenly stop? Absolutely. Absolutely, that happens. But most of the time, it requires some outside intervention. It requires some help so that we can really get an understanding of where the pain comes from in the first place. Question number 4. What questions can I ask a treatment center to make sure they're a good fit? Boy, there are some real bad ones out there. There are treatment centers that within the first 2 minutes that you're on the phone with them, when they're asking you, "Hey, what kind of insurance do you have?" That would probably be my first red flag. Like if they're more interested in finding out what your insurance is versus how they can actually help your loved one, that would be a conversation that I cut short really, really early on. They are probably just looking to bill insurance or making sure that you're financially qualified to even have this conversation with them, rather than actually get invested in the conversation, get invested in your loved one, and see if they can actually are we a good fit, or do I need to refer them somewhere else? Um, some questions that families can ask very early on in the process before you even get on the phone with them. If the website does not have a page that lists their staff members, that lists their credentials, where you can see, oh, okay, these are the clinicians that are going to be working with my loved one. This person over here is in charge of the recovery program. This person over here is in charge of the residential staff and the techs. Oh, this is the chef and he's in recovery too. Like there's all kinds of different people that treatment centers will put on their website, and it's important to pay attention to that because that will give you some indication, not only like, hey, are these people hanging on to their employees long enough to be able to put them on their website and have some longevity? Are they invested in their team? Who then the team will be invested in my loved one. Are they qualified to be doing the job that they're doing? You know, are they actual master's level or PhD level therapists, or are they LCDCs, licensed chemical dependency counselors, which is a certification rather than a clinical degree. And so that's why you want to really pay attention to a lot of those things on the front end. Once you're on the phone with them, find out a little bit about the daily structure. You know, are they going to have a private room, or are they going to share a room? Hopefully they're sharing a room. A lot of families lately have bucked at that a little bit as I've had conversations with them. Well, you know, they're not going to like having a shared room. Well, of course they're not. They're not going to like going to treatment in the first place. But most of the time, a good treatment center will have someone in a shared room to prevent isolation, to prevent that person from going in the room, closing the door, and shutting themselves off from the entire experience that they're there to have in the first place. And so you want to see, okay, what time are they required to get up? What are they going to be doing first thing in the morning? Is there an exercise, you know, component to this? Is there what kind of experiential therapies do they have? Is it all talk therapy, or are they going to do some experiential work? Are they doing equine work? Are they doing, you know, any kind of trauma work? If so, what kinds? Um, are there therapists trained in different therapeutic modalities, or are they all kind of doing the same type of therapy? Kind of the staples of most treatment programs are cognitive behavioral therapy and dialectical behavioral therapy. But there's also a number of other types of therapy. EMDR is a good trauma therapy for people that are ready for that. IFS, internal family systems, is a wonderful therapeutic modality for a lot of us. You know, you want to find out what kind of treatment modalities they're involved in. And then in the evening times, okay, what are you doing in their downtime? Are they just hanging out watching TV? Are you guys taking them to 12-step meetings? Are you getting them integrated into a recovery community? Are you teaching them what it's like to be in recovery after they leave treatment? Um, that's really an important component to the day-to-day life of the client. Then you want to ask them, okay, so what kind of communication can I expect from you? How often, if my loved one, of course, signs a HIPAA release, which is up to the client, they can't force them to sign a HIPAA release, and they can't talk to you without one. However, a good treatment center is going to continue to try to get the family involved along the way. You want to make sure that that treatment center is going to be connecting with you. If you're working with someone like me as an interventionist, you're going to want to make sure that they're communicating with the interventionist as well, so that that interventionist can help support you even after the client is in treatment, if that's part of the services that they provide. Not all of us do that, but most interventionists will have some degree of support after the client is in treatment, because let's say the client gets into treatment a week into this experience, they get thirsty, I mean, it's kind of a crude way of saying it, but they, you know, they make a bad decision. They leave treatment AMA because their mind is screaming at them, "Hey, we need a drink. We need a drug." and they don't yet have the defense to be able to work through that, and they'll leave treatment early. Okay, well then what? How much communication are we going to have in a circumstance like this? What are we going to learn if our loved one starts to look like they might be going sideways? What kind of treatment, excuse me, what kind of communication can we expect when things are going well? Um, it's going to be really important that the treatment center have some sort of wraparound component for the family. Before COVID, there so many treatment centers had in-person family programs where the families would actually go for 2 or 3 days, sometimes longer, and actually be at the treatment center and do family therapy with a clinician and their addicted loved one. And then COVID hit, and it just seems like a lot of treatment centers have not gone back to that, and I wish they would. I wish treatment centers would start to include a more robust family program, because the recovery rates go up when families get the right education and they actually get to do some family work with their addicted loved one. And that the families being encouraged to get into a recovery program of their own, whether that's Al-Anon, whether that's adult children of alcoholics and dysfunctional families, whether that's CODA, Codependence Anonymous. There are so many different organizations out there to help the loved ones of people in active addiction who are also going through a lot and maybe have come from alcoholic or addicted families themselves. And so to really make sure that the entire system is getting healthy along the way is a really important piece of this. If all they're going to do is, hey, we only have the ability to focus on your loved one, we'll let you know what their discharge date is, and we'll let you know what the discharge plan is going to look like, but that's about it. You might want to keep looking. The other thing you can do, even if an intervention isn't needed, reach out to somebody like me and say, hey, I really want to find a good treatment program for my loved one. It doesn't have to be me, of course. There are people like me all over the country, and most of the time, for either no cost or a very small cost, we will help families find good treatment programs. Most of us don't refer to programs that we actually haven't visited and seen and put eyes on ourselves. So there's a sense of familiarity, there's a sense of comfort and confidence that we have in the programs that we're referring to. A lot of times we have experience in referring clients that we've done interventions on there, and they've either worked really well or no, I would avoid that treatment program because this is where they fell short with a client that I recently put there, or I put there a couple of years ago. And so you're going to get more anecdotal evidence of what's working and what's not working when you engage a professional as well. And so that's another advantage of using somebody like me. Even if an intervention isn't something that you're going to need, there are people out there that just have a wealth of knowledge that you could benefit from, and most of the time it's going to be very inexpensive to do that. Last question here: what are your thoughts on non-alcoholic beverages for someone who is sober? you know this never made sense to me. uh, I never drank for the taste, I drank for the effect. I was talking to a buddy of mine the other day, and he recently made the decision to stop drinking. And one of the things that he said to me is, I found that there's some really good tasting non-alcoholic beer out there. And my first thought, I didn't articulate this out loud, but my first thought is, what the hell does that matter? Like, good tasting non-alcoholic beer. Like, why would you drink that? It's like drinking water, or drinking a Diet Coke. Like, why would you do that? You're not going to get drunk. And that's the mentality around somebody who's actually alcoholic in recovery, is that most of us don't drink for the taste. We didn't drink wine because this particular wine went really good with a steak, or this wine went really good with fish. We drank because this wine had a higher alcohol content than this wine, or this whiskey had the proof was higher than the vodka. It That's really what we were looking at when we were drinking, is what's going to get me where I want to go as quickly as possible. Now, don't get me wrong, there are one-offs here and there where people hey, I had a particular brand of beer that I drank. I've got a guy that I've been working with that he only drinks Modelo. I mean, he drinks a lot of Modelo, but that's it. That's all he'll drink. And I get it, but it's quantity versus quality for most of us. So the idea that we can safely consume non-alcoholic beer or non-alcoholic drinks that I've been seeing on social media, a lot of advertisements for alcohol alternatives. I think that's pretty thin ice to be getting out on. Um, because most of the time when we start to consume something that even reminds us of what we were doing in active addiction, um, it's just a matter of time before we start looking for the effect. Even subconsciously, it's like, it's funny. I'll go to a restaurant with my family and I'll just order water, but I'll drink water like it's still gonna get me drunk. Here I am 22 years so sober, and I'll time ask the server, "Hey, can you just bring a pitcher?" 'Cause they're filling my water glass up, every time they cut a drink over the table. It's now it's easy for you if you left the pitcher, because I'm gonna drink when I'm at a restaurant. That was one of my things. I could drink because I wanted to get that effect. And even though I know that water is not going to get me drunk, I will continue to drink it as though it will, just out of habit. And so I think we have to be careful. I think we have to be careful. I'm certainly not going to sit here and say that it's not that it's a good idea. I'm sure there are people out there in recovery that have non-alcoholic drinks, non-alcoholic beer. I just don't think that it's the safest position to be in, if you're going to be in long-term recovery. If that is your goal, it's really about staying as far away from the ledge as possible, not seeing how close to the ledge I can get without falling over. Uh, so those are the 5 questions that I picked out of this group. If you have a question that you would like to submit, please email me at matt@partyrecords.com. If you would like to book a one-on-one consultation with me or any of the providers at Intervention on Call, please go to interventiononcall.com and book a session there. I'd love to meet with you and help you with your particular situation. Again, I'll say it as a reminder here at the end. Every Monday and Thursday, we have a 1 hour Zoom meeting for families in crisis at 8 p.m. Eastern. You go to interventiononcall.com to register for that. It's completely free. I'd love to see you there. And, in parting, I'll just say, like I always do when I sign off, I hope that your loved one gets sober and stays sober. Thanks for tuning in.